Hey, this is Tony B with Rainier Avenue Radio with breaking news. We've been hearing a lot of information about the vaccine, its availability, whether we're in phase 1A or 1B, the shortage of vaccines, who gets the vaccine, how the vaccine gets distributed. I am live right now at the Ethiopian Community Center. It's a pop-up vaccination site. Seattle Fire Department is providing the vaccines, and so vaccines are coming to members of our community, our diverse community in South Seattle. Right now, I would like to introduce you to Sega and have a few words with Sega, who's the program director here at the Ethiopian Community Center. Sega, tell us a little bit about the Ethiopian Community Center, when it began, how it got started, and why it got started.
Hi, my name is Sega. The Ethiopian Community Center started about 30 years ago. We provide job referrals, housing referrals, employment referrals to our members. We also help with immigration. Those who need immigration referrals, they can come here and we can help them as well. So we've been in the community for 30 years, and yeah.
What role does the Ethiopian Community Center play within the community, the Ethiopian community here, the East African community?
So our doors are open to the East African community, especially obviously to the Ethiopians. As you know, there's language barriers in navigating systems. So we provide translations, we provide help for people who need, for example, health. How do they get to a doctor? We help them with navigating systems and breaking that language barrier. As well as finding jobs for them. So our doors are open. Anyone in the community can come in and pop in. Of course, now that it's COVID, we're closed, but we do help through the phone making appointments. So we've been doing that for the past 30 years.
And how has the pandemic specifically impacted the Ethiopian community? What types of challenges have you faced? We know that there are, again, language barriers. Have there been health concerns? Of course, many people own businesses as well. What are some of the challenges that the Ethiopian community has faced during this pandemic?
Like you said, a lot of our members have lost their businesses. So we've been providing grants to people for rental assistance, utility assistance. We've also, a lot of people need, like if they want to do business applications, we've been helping them with filling out business applications. If people want just general information on how do I do this during the COVID, we've been providing that information. So we've been here for the community, and then we've been fortunate enough to get some grants to help people out with this pandemic. Before the pandemic, we used to have events. Those are not, obviously we can't have those. So our income has been affected. So we're trying to be here for the community to help in different avenues, through helping them with available jobs, and for businesses helping them with filling out forms. So that's what we've been doing.
And the vaccine is available now. We've been waiting for this. There have been some questions about the vaccine. Some folks, I think 24% of the public says that they won't take the vaccine, but then a number of folks are trying to get the vaccine. What has been the response in the East African community regarding the vaccine? We know that there are limited numbers of vaccine. Is there interest in taking the vaccine in this community?
So one of the programs that we work on is the health program, which is fighting chronic and disease management. We have a health council here. So we educated our community. We held a Zoom workshop. We invited doctors from our community, and using Amharic, which is our common language, they explained to them about the vaccine, the myths around the vaccine, what to believe, what not to believe. So we've had a huge positive response. So during this round, we're vaccinating 65 and above. And if you're 50 and live in a multi-generational home, we're giving the vaccines through registration, that is. We've had a huge response. We have a lot of people on standby. So today we are only vaccinating people that have reserved a spot. And for future vaccination spots, we have a long line of people that we have registered. So This teaching is also on our YouTube channel, on our Facebook, in case anyone is interested, so people can listen to it again. And having continuous workshops has helped to educating our community to dispel the myth around the vaccine. And we have another, a second workshop also planned in February to educate our community further about the vaccine. So the need is there.
And how were you able to secure vaccines for your community?
So this is the second time we're doing it. The first time we partnered with Swedish Hospital. Today we're partnering with the Seattle Fire Department, and they've been fortunate enough to give us some vaccines for free for our community. So we're very grateful for the fire department, for the Seattle Fire Department.
Well, Sega, thank you for what you do in our community here at South Seattle, especially during these times. And I want to give you an opportunity here if there's anything that you'd like to say to our communities.
Thank you for giving me the chance, Rainier Avenue Radio. Also, thank you to the Seattle Fire Department for giving us this chance. If there's any other organizations that can provide vaccines, our doors are open. We can reserve, and then we have a huge parking lot. We can put up tents. We have a huge community hall where we can do the COVID-19 practice to make sure that people are apart and administer the vaccine. So we're ready for the third round of vaccines, so let us know. Thank you so much.
All right. Thank you. This is Tony B, live Rainier Avenue Radio, and I'm going to have Sarah join me from the Seattle Fire Department. Now, I vaguely remember the title. I know that it had to do with COVID-19 response. So let's start off with that, maybe by you introducing yourself and the role that you occupy, and then how the Seattle Fire Department became engaged and involved in vaccine distribution.
Yeah. Hey, I'm Sarah Smith from the Seattle Fire Department, and so my role is COVID-19 response coordinator. And what that really means is I've been doing the COVID-19 work since the very beginning. So I worked with Captain Brian Wallace in getting our test sites going, so our community test sites. That was the first big role that we had, really addressing COVID-19 in the community. And then we just transitioned into vaccine. So we have the medical staff that are able to do the vaccination process. We have the people here who are able to do registration, and so it seemed like a good fit. Seattle Fire Department is always trying to help the community out, and this is the right space for it right now.
And let's talk about this a little bit. What is that process like? We know that it's difficult to store, to keep the vaccine. There's expiration on it. How is the fire department logistically handling the vaccine, from picking it up to holding it to getting it where it needs to be in the communities?
Yeah, it's a really good question. And I've learned so much more about cold chain, storage, and dry ice and freezers than I've ever known before. But yeah, there's a huge process, and so we receive it from the DOH, so they send it to us weekly. And this is why it's kind of tricky, because we never know how much we're going to get until we find out the weekend before we're actually doing it. And so we send in our orders on Monday, and we find out Friday or Saturday if we're going to get it for the next week. And so it's always kind of a balancing act of when we're going to go. We receive it, we have to put it into a freezer, we have to make sure it's always kept at the right temperature. Once it comes out of the cooler like it is right now, we have to make sure we use it within our 8-hour period. So that's why it's just such a process, and we have to be really organized with it, because we don't want to waste any of this resource.
Now, when we were talking earlier, did you say you were the only fire department? Or, no, okay. You didn't.
No,
okay.
no, not the only fire. I'm from the Seattle Fire Department. Fire departments across the nation are trying to help the community do this, because EMTs have, at least in Washington State, EMTs have the ability to now be vaccinators.
All right. And Sarah, who determines where the vaccine will go in the distribution process?
Yeah, it's a huge partnership actually between the state DOH department, public health, and the city of Seattle. And they are making sure that we're following the DOH guidelines that have been set out. And so when you mentioned the phases, those phases specifically, making sure we match that. And then it keeps on coming down. So the city works with the community, and works with public health and the DOH to do these events.
And there's a goal also, would that be correct, in trying to reach what are called vulnerable communities?
Mm-hmm. Yeah, so that's where the tiers come from, in that we're trying to hit the highest risk for people. And so that's why we're starting at the age of 65 and older. And so we're really working on our vulnerable seniors who are at highest risk with COVID-19. So that's where we're at right now. We're doing specifically seniors today.
And how do you determine, or what information are you using to determine vulnerable communities?
Yeah, Yeah, so this is coming from the city of Seattle, and the mayor's office is working with a lot of different community partners, health officials to make that determination.
All right, Sarah, thank you. We'll give you opportunity for final words here. There's something you'd like to say to our communities.
No, thank you so much for listening. And when you're talking about hesitancy with the vaccine, and I know there's frustration out there with being able to get vaccine, where to go. It's coming soon. When we get more vaccine, we're going to really try to get everyone vaccinated. So thanks for sticking with us.
Thank you. This is Tony B, Rainier Avenue Radio. World. I'm live from the Ethiopian Community Center at what is called a pop-up vaccination location. And this is invitation only. And so if you haven't been invited, you can't come down. But they are servicing the needs of the members of the Ethiopian community. If you are wondering, well, how can I get this? I'm part of a vulnerable population. I'm part of the Filipino community. I'm part of the Black community. I'm part of the Pacific Islander community, which has really been hit hard by this. You have to have a partnership with the mayor's office. The mayor's office at that point will then maybe talk to you, come to you, find out where you're at and see if they can set up a site at your location so you can get a vaccination as well. Again, these vaccines are hard to come by. You know, people are, you've heard us talk about the frustrations all over the state in trying to accommodate people who want the vaccine and are unable to get the vaccine. Well, in Seattle, there is an opportunity for your community to receive the vaccine. There are 1,000 here today. So if you have a community group, then you should get organized, contact the mayor's office, and see if you can't be part of that information to receive vaccinations for your group. Again, they will be following the phase-in information and CDC guidelines, but there are a lot of folks here today who are going to get vaccinations in your community. Again, if you'd like to see a vaccination happen, form a partnership with the mayor's office. Hopefully, if you have information that's been aggregated and you can make a case as to why you should be on this list, then you can get vaccinations in your community as well. But today there is a pop-up vaccination site, invitation only here at the Ethiopian Community. And so for those members of our Southeast Seattle community who are from the East African community, there's 1,000 vaccines here today, and there is a line, and folks are eager and they're excited about it. We'll find out more about this program at 1 o'clock today if you join us on the air for our weekly broadcast of the impact and the effects of the coronavirus on Southeast Seattle and surrounding communities. So once again, this is Tony B. I'm live from the Ethiopian Community Center. Pop-up vaccines delivered by the City of Seattle Fire Department, administered by EMTs who can now give vaccines. And again, another effort to make sure that members of our diverse community get this vaccine. So again, if you're interested in getting vaccines for your community, find out where that is, organize, contact the mayor's office, and get on the list and see if you can get the fire department to bring vaccines to your community. All right, this is Tony B, and we'll see you at 1 o'clock for our regular broadcast, the impacts of the coronavirus on South Seattle and surrounding communities on Rainier Avenue Radio.World.